Aloha, this is Dr. Tim Henlon at the Henlon Chiropractic Health Center in Kailua, Kona. We're talking with Lucas and his parents, um, Steve and Colleen, and we're just reviewing after spending 3+ months working on a program with Lucas for a number of conditions that had put him in a state of really crippling arthritis. And Lucas, tell us a little bit about what your experience was. What were you going through? How long had you been going through it?
It was about a year and a half of crippling arthritis. My hands were like balloons. I couldn't hardly sleep. Couldn't get out of bed some days. At the worst point, I couldn't open a door or a car door. It was just horrific.
What condition were your hands in?
I could barely bend them, or they were like stuck like claws. They were all ballooned up.
Yeah, you described them as balloons the other day to me. Okay. And what were you doing prior to that with your work? What kind of activities did you used to do?
Before I got sick, I was a scuba instructor, working on the water, super active. I'd go to the gym multiple times a week, ride my motorcycle. And then I ended up getting sick. It was kind of triggered by a sea urchin. And then I ended up getting really sick off of that and wasn't able to work as a scuba instructor anymore or dive master.
Okay. And it basically became pretty much disabled where you weren't able to do much of anything.
Yeah.
Okay. And how long had that been going on, roughly?
About a year and a half.
Okay. And what was that like having your son experiencing that kind of problem and being, disabled?
I'd say it started out as shocking. We came out here to visit and found him in a disabled condition, and it was we didn't realize what was going on at all. But he needed to have a complete change of lifestyle. He needed to be cared for. Actually, he needed full-time care, and we dropped everything that we were doing literally, and bought a house here, came here to live with Lucas and try and figure out how we might be able to help our son recover.
And so they sent him to the rheumatoid arthritis rheumatologist, and she diagnosed him within 30 minutes with rheumatoid arthritis. And Lucas wanted to find out the cause of it, and she prescribed 3 medications, pharmaceuticals, which were a lot of bad symptoms. And I remember walking out in the parking lot, and Lucas says, "Mom, I can't take these drugs. Look at these. They're bad for your heart and everything." So I said, "We're going to figure this out." So Lucas found a friend that had a nutritionist who focused on autoimmune. And so we started an AIP diet to help Lucas. I helped some, every little bit of everything. People would tell us all kinds of ideas to help him. Like, try the sauna, the red light saunas, and different things. And so Lucas was willing to try anything to get better. And then we found another doctor, and he helped us. He did triage and did really good, and helping him with his being able to sleep, because he was in so much pain he couldn't sleep. It was horrific for him.
All right, so we found that doctor, and we did antibiotic therapy through him, and he also recommended getting a CAT scan done, because I mentioned earlier I got hit by a sea urchin really bad, and I got a CAT scan done for my hand. You kind of see the scars right there where I had the urchins in there, and they found a few in the CAT scan. We had the surgery, and there turned out to be 37 pieces of sea urchin in there. So that was really the first turning point in my recovery. And then I discovered Dr. Henlon. I came here just for my back was bugging me for chiropractic. I was getting a lot of like fibromyalgia symptoms because I wasn't able to sleep and in chronic pain. And Dr. Henlon kind of, number one, helped me with my back and my chiropractic stuff, gave me a good routine for getting a little bit more physical with yoga, which was definitely a key element and everything. He got me off of all the pharmaceuticals, which was really a good thing to do. And that was over the past 4 months since I've been off of those pharmaceuticals. My health has just skyrocketed and gotten better and better. So anybody taking pharmaceuticals right now, I urge you to think about that and really look for somebody else who knows what they're talking about. Because it really is a lifestyle change. I'm vegan now. That's helped immensely as well. So it's really a whole lifestyle change that's put toward my recovery.
Yeah, so we went into a nutritional medicine program to replace the drugs with functional nutritional medicines, and had great results with it. It's really been remarkable how fast you've. So recently we were talking about the ballooning fingers and the crippling arthritis. So now you mentioned the other day to me that you're able to wear rings, you're playing guitar again,
Yeah.
that kind of thing. And mom and dad have seen the changes, and it's really, I didn't realize that you guys had actually moved here because of Lucas's condition. That was news to me. So it's really been a whole family experience of watching him get well.
Oh yeah, without the community, the first doctor and you and Henry's practice here and our being here, Lucas would be dead. He would be dead, and he's not. In fact, the recovery is phenomenal, and he's healthier now maybe than I think he might have been in all of his life. It's just been a complete turnaround in a fairly short time.
Yeah.
Just amazing. The results have been amazing.
Yeah, no, I'm very excited about the changes and the recovery and how fast it was. The other doctor that you had seen is an internationally known specialist in things like fibromyalgia and chronic fatigue syndrome and those kind of, and we credit him with being of assistance, but we had been able to then take you from that point where you were still using multiple drugs and get you off the medications and into a whole different functional nutritional approach that fortunately was very effective for you. So it is exciting, and I really appreciate your sharing the family experience and your recovery, Luke. It's been for me really a joy working with you. So and watching the recovery. So thank you for sharing that, and we'll continue to make great progress and see things improve so that you can go on and do whatever it is you want to do with your life at this point.
Right on.
And hopefully you guys have grown accustomed to Hawaii enough that you want to hang around here and stay.
Yeah, it's not so hard to wake up in paradise every day.
And you were telling me that when he's got recovered, that it was really, he couldn't study before. He had not been able to take the test for the captains and any of that. He basically, his brain shut down and was in a state of despair, or what was
it was
waking
absolute despair, and he couldn't concentrate. I mean, he couldn't concentrate long enough to read a paragraph. He had no desire to do anything like that. It was a complete brain fog, and to watch him recover now and be able to sit down and study literally for hours, play guitar for as long as he pleases, the difference mentally is just huge. To watch not only just the physical but the mental recovery, and see him now be able to do what he wants, when he wants, with goals, and reach out for those goals. Just the entire spectrum of recovery from physical to psychological and mental has just been huge.
Great. Steve, thank you for sharing that. I appreciate it. No, it does make a huge difference, and we live in our emotions, and we live in our goals and our actions day to day. And so without that, life can get pretty purposelessness,
Hopeless.
So, really hopeless.
Hope. Yeah.
You feel that way?
Oh yeah. Yeah, for a long time I didn't have hope. I didn't want to go out and see friends, For like a year and a half I isolated myself just because I was in so much pain and just trying to cope with everything. I just smoked myself silly and just tried to get by, So now, things are definitely turning around.
Super. All right. Well, thank you again.